What are the top 3 risk factors for recurrence after surgery for ductal carcinoma in situ? I'm Dr. Amani Jambakar. I'm a fellowship-trained breast surgical oncologist, and let's talk about it. The first risk factor for recurrence is a close or positive margin. What that means is that there were cancer cells or DCIS cells which were too close to the edge of what the surgeon removed. What this picture is showing is a mammogram of a lumpectomy that a surgeon performed on a patient, and there are white dots close to the edge, meaning that this patient either has a close or a positive margin. A close margin is less than 2 millimeters. The second risk factor for recurrence is high nuclear grade. This is what that looks like under the microscope. You can see that high-grade DCIS does look a lot less organized than low-grade or intermediate-grade DCIS. And the third risk factor for recurrence after DCIS is young age. Patients who are under 40 or 50 years of age tend to have higher recurrence rates than those who are older. Now, if you have all 3 of these risk factors, that doesn't necessarily mean that your DCIS is going to come back. Different studies have shown ranges between 20 to 30% in terms of the recurrence risk at 10 years if you have all 3 of these risk factors. I should also add that if you do have a positive or close margin after ductal carcinoma in situ and you have a re-excision surgery and that comes back all clear, then you have the same rate of recurrence as someone who didn't have a positive or close margin to start with. It's important to know these risk factors so we know who we need to keep an eye on, but the vast majority of people with ductal carcinoma in situ never see it come back.